Good morning. Can everybody hear me? Excellent. How's your first 2 weeks been? No comment? Good? You enjoying it? ICM? Good? Yeah? PBL? We're starting to understand the concepts? Yes? Excellent. All right, autonomic nervous system. Who's heard of the autonomic nervous system? Nobody else? Just a few over there? You've heard of it up there as well? We've just heard of it, or do we know about it, those that put their hands up? Yeah? All right. Well, then some of this will be familiar to you, and for others, it'll be new. So it's an important part of the overall nervous system, the autonomic nervous system, and disturbances of this system feature in many disease states. So it's actually quite an important system. So there's your basic learning objectives for this particular lecture. So we'll go through the physiological and anatomical differences between the sympathetic and the parasympathetic nervous system, which makes up the autonomic nervous system. You'll look at which neurotransmitters are released at both the preganglionic and postganglionic sympathetic and parasympathetic neurons, including the adrenal medulla. And you'll be able to describe some of the major functions of the system and the consequences of its dysfunction. So if you have a look here at this diagram, so there's your nervous system, and that's broken up into 2 sections. So you've got your central nervous system here in the purple, which consists of your brain and your spinal cord, and then the peripheral nervous system, which is distributed throughout the entire body, as you can see here. Then your peripheral nervous system is further broken up into your somatic nervous system, so that communicates with the sense organs and the voluntary muscles. And then the system, and that is further broken up again into a sensory nervous system and a motor, so a sensory input and a motor output. And then over here we have the autonomic nervous system, which communicates with the internal organs and the glands, okay? And then that's broken up into what most textbooks will tell you is a sympathetic division and a parasympathetic division. But there's actually a 3rd division, which I won't be talking about today. You guys will get an idea of that next semester when you do your gastro block. But that's the enteric division. So that controls the digestive tract, okay? And that's mostly voluntary, so that is part of the autonomic nervous system, okay? So autonomic means it happens generally without you guys knowing about it. Your body just goes about its daily business, and this system is constantly working. So it's largely responsible for homeostasis, and I think you guys have a lecture on that today, is that correct? Yep. Is that directly after me? No? There you go. I don't even know the timetable. So it maintains homeostasis and ensures the internal organs are operating efficiently, and it makes appropriate adjustments, as I said, as you go about your day, depending upon the situation. It's based largely on reflexes, so you have sensory afferent inputs and motor efferent outputs, okay? Similar to the somatic system, but a little bit different. It's a complex neural network that controls many elements of the body's physiology, okay? So it innervates smooth and cardiac muscles and glands. So smooth muscles is what lines the blood vessels and the hollow internal organs such as the stomach, the intestine and the bladder. And as I said, it operates autonomically, but components can be influenced by higher order processes, okay? So some functions such as breathing, you can override the autonomic nervous system. So when you're stressed, some people will do slow, deep breathing and try and get their sympathetic nervous system under control, okay? People that meditate, it's a similar kind of thing, okay? I'm sure you guys have all been in a situation where you're extremely stressed and you've been told to do slow, deep breathing. That's where those higher order processes can come into it. So as I said, it is mostly relies on reflex. So this is just a diagram of an autonomic visceral reflex arc, okay? So there's 2 components, as I said, the sensory or the afferent. A bit off looking here. Okay, so there's a stimulus, here's the sensory side of things, okay? So the afferent pathways, that conveys the impulses here to the central nervous system. Once the stimulus depending upon the stimulus gets to the central nervous system, the body decides, or the central nervous system decides what's going to happen, and then the efferent pathways come out, which are the motor pathways, and that conveys the messages to the organs and the tissues, so you get a response here, okay? So it's predominantly a motor system, the autonomic nervous system, and I'm only going to be talking about this side of things here today. Not what's coming in, just what's coming out, alrighty? So as we said, there's the three divisions. I'll only be talking about the sympathetic and the parasympathetic today, not the enteric. So the sympathetic is the accelerator or the arousing side of the system, and then the parasympathetic, which is the brake or the calming side of the system. Has opposing or antagonistic effects, and organs or tissues that receive impulses from both systems have dual innervation, but not all are co-activated by both systems. So the majority of blood vessels are not innervated by the parasympathetic nervous system, okay? The salivary glands, some of the gastrointestinal glands, and the genital erectile tissues are, but the majority of the rest of the blood vessels, the rest of the blood vessels in the body are not innervated by the parasympathetic nervous system. Oh, wrong one. And that's just what we said before, the complex reflex pathways integrated by the two systems. So you have the sensory receptors, the afferent pathways conveying the sensory impulses to the brain, the regulatory networks once you're inside that central nervous system, and then the efferent pathways is what comes out and conveys the message to those organs and tissues and then to the target organs. So both systems have two sets of connecting or motor efferent neurons for conduction of impulses between the the central nervous system and the effector organ. First one's the preganglionic neuron. So that cell body is located in the CNS, and its axon extends to the autonomic ganglion and synapse onto the postganglionic neuron. And I'll show you some images that'll show that a little bit better very shortly. So autonomic ganglion is just a cluster of neuronal cell bodies located outside of the central nervous system. And postganglionic neurons, so they're located outside the CNS within an autonomic ganglia, so either a paravertebral sympathetic chain or other plexes, and it innervates the effective organ. And this will become a little bit clearer within the next few slides. So this diagram here shows you what I just mentioned. So we're comparing, this is just comparing the innervation of the somatic and the autonomic system. So the somatic or the motor system is a one neuron pathway, okay? So it just neuron comes straight out of the central nervous system and synapses straight onto the target tissue. In this case, it's the intercostal muscles. But the autonomic system is a two neuron pathway. So you've got your pre and your postganglionic neurons. Okay, so there you can see there's cell bodies of the preganglionic sympathetic neurons are located here in the lateral horn, the grey matter from T1 to L2. Some textbooks will tell you to L3, so I will take L2 to L3 if that does happen to come up as a question in an exam. Don't freak out too much about that, okay? And here's your preganglionic neuron coming out of the central nervous system and synapsing here onto an autonomic ganglion, and then your postganglionic synapsing onto the target organ, in this case the heart. What you can see here is the difference between the sympathetic and the parasympathetic divisions. So the sympathetic has a short preganglionic neuron and a long postganglionic neuron. And the parasympathetic is a little bit different. It has a long chain, a long preganglionic neuron and a very short postganglionic neuron. Okay, that's the difference there between those two parts of the system. And then we'll talk about this shortly. A bit of a unique variant here is the adrenal medulla. So here's your preganglionic neuron coming out of the spinal cord here. And it essentially synapses within the adrenal medulla, okay? It's almost like the adrenal medulla is a postganglionic neuron, but we'll talk about that shortly. So the sympathetic nervous system. So those that have heard about it will have heard that it's called the fight or flight response. And it's the body's response to perceived threat or danger. So this is the classic image. We often say a caveman comes across a woolly mammoth or whatever it happens to be, and the body decides whether it wants to stay and fight or whether it wants to flee. We don't come across those things these days generally, but you all sat for MMIs, yes? How did you feel? How were you feeling when you were waiting to go in for the interviews? Were you nervous? Yeah? So what did you feel within your body? Yes? Sorry?
Sweaty hands.
Sweaty hands, most definitely. Anyone else? No? We were all cool, calm and collected, were we? Your sympathetic nervous system, for the majority of you guys, would have been in overdrive, okay? You can't necessarily fight. You can't flee in that situation, okay? So you just got to sit there and deal with it. For those of you that don't like to sit in traffic, like myself, often your sympathetic nervous system will kick into place, okay? And that's the problem in this modern society with the sympathetic nervous system. We get stressed with a lot of things that we have no control over, okay? So in this situation here, you could decide to stay and fight, or you could decide to run away. When you sat your MMIs, or when you're stressed out in traffic, or numerous other stressors that we have here in modern society, we can't do that. And that does cause problems with people, okay? And it can lead to high blood pressure and all sorts of other issues. So yes, heart rate, increased rate and force of cardiac contraction, okay? Constricts the blood vessels, so there's a vasoconstriction, so that increases the blood pressure. So the blood flow is shunted to skeletal muscles in case you do want to run or fight, and also to the heart. It releases sweat, yes, and it dilates the pupils. Relaxes the airways, so there's a bronchodilation, so you can get more air in. Increases the glucose, which is fuel for the body, and it liberates adrenaline, okay? We call it adrenaline and noradrenaline. In America, they call it epinephrine and norepinephrine. So depending upon what you're reading, they're interchanging, okay? So the modern example I think that you might have heard of, for those that have heard of it, is that you come across a knife-wielding maniac in a dark alley, okay? So this is going to happen. You're going to have an increased rate and force of the cardiac contraction. The blood vessels will constrict, sweat release. So the pupils dilate. It allows more light in, okay? Relaxing the airways, glucose and adrenaline. So the system is also known as the thoracolumbar system. Does anyone know why that is? Yep.
Is it because the region is within the back of the thoracic region and the lumbar region?
Correct. So the preganglionic neurons are located in the lateral horn, as we said, of the grey matter, the first thoracic to the third segment of the spinal cord. So again, depending upon what you read, it will be down to L2 or L3. Alrighty. They're arranged in a rostral to caudal viscerotopic organisation. So that just means rostral is nose and caudal is tail. So it's arranged according to the tissues that it innervates. And acetylcholine is an excitatory neurotransmitter of the preganglionic neurons in the sympathetic system. So, the preganglionic axons exit the spinal cord via ventral root of a spinal nerve. Where are we? There's one there. Okay, so they come out here by this ventral root. They separate from the ventral root and form a white ramus. So they'll come out here, and here you can see this white ramus. So we'll come down here where it's actually highlighted. White ramus or white ramus communicans. that just means it's a communicating branch, okay? It's just a short connection between a spinal nerve and the sympathetic chain, which you see here. So there's your spinal cord, here's the vertebra, and here's the sympathetic chain here. So the nerves will come out and they'll come through into one of these white ramus or white Raman's communicans. It'll enter a paravertebral ganglia, which is this here, or a sympathetic chain or a sympathetic trunk. So there's a few different names that's given to this, okay? And it's called a chain because they're connected to one another, basically, okay? Or a trunk, like a tree trunk. And it'll do one of three things once it enters this trunk here. So it'll synapse onto a postganglionic neuron at the ganglion on the same level. So if it comes in here, it'll synapse here, or if it comes in here, it'll synapse here, or it might come in here and synapse at a different level. So it might go up and actually synapse here, or it might go down and synapse here, or it'll pass through without synapsing at all. So it'll come in, it'll come back out, and it'll go down here into one of the thoracic splanchnic nerves, and it'll go to a different ganglia, a prevertebral ganglia, okay? Most will synapse here, will come in and synapse on the same level that it entered the system. So this is just showing you the same thing, but it's broken up a little bit into the three variations. So here you have the preganglionic neuron come out, comes into this ramus, the white ramus. Does anyone know why it's white? So you've got a white here and a grey here. Does anyone know the difference? Very good. So it comes in here through the white ramus into the sympathetic trunk or chain, synapses with the postganglionic, out it goes, and off to its target organ, so the blood vessels or the sweat glands. Or, as we said, it'll come out of the central nervous system, in through the white ramus, doesn't like that spot, synapses up here, out the grey ramus, and again off to where it needs to go, or it'll come out from the central nervous system here, in through the white ramus, through the trunk, and straight out, okay? And it'll synapse with another ganglion down further or away from this trunk, and then go to its target organs. Does that all make sense so far? So, in addition to the paravertebral sympathetic chain or trunk, there's the prevertebral or the collateral ganglia. So they're situated between the sympathetic trunk, so that's your sympathetic chain there. And so it's situated between the sympathetic trunk, so past the sympathetic trunk, and the target organ. They're not paired or segmentally arranged, and they only occur in the abdomen and the pelvis. So they're generally your splanchnic nerves. And they all lie anterior to the vertebral column and mostly on the abdominal aorta. So here you've got a superior cervical ganglion, middle cervical ganglion, celiac ganglion. So you've got a few different ones there, but they're always going to the abdomen and the pelvis. So there's also what we call autonomic plexuses. So they're formed from sympathetic and parasympathetic fibres that innervate and regulate the overall activity of the visceral organs. So they're basically a tangled network of sympathetic and parasympathetic neurons, okay, and they lie along the major arteries. Complex interconnected neural networks formed by ganglia and axons found close to the major arteries and are named according to the organs they supply. So basically I think of it, or the easiest way to think of it, an autonomic plexus is like an electrical junction box, okay? So that distributes wires to different parts of your house, in this case, your body. So in a plexus, the nerve fibres from different spinal nerves are sorted. So you've got the parasympathetic and the sympathetic nerves coming in, they're recombined and they all go to a specific body part, but they're put together in one nerve. So that's what an autonomic plexus is. So there's an esophageal plexus there. You've got a celiac ganglion and a plexus. Okay, that's a ganglion, superior mesenteric ganglion and plexus. So it's basically like a junction box. And that's just another diagram. It's probably either or, which diagram you prefer to use, okay? So you can see your plexus and your ganglia here. So it's quite complex in this region, in the abdominal region, when it comes to the nerves. So the adrenal medulla, which we mentioned, is a unique variant of the sympathetic nervous system. So modified sympathetic ganglion whose cells are similar to sympathetic postganglionic neurons. So it synapses within the adrenal medulla. So the preganglionic autonomic nerve fibre synapse directly in the glands, and it secretes adrenaline and noradrenaline directly into the bloodstream. So here we come out of the central nervous system, through the white ramus, into the trunk, no synapsing, straight down through a splanchnic nerve here, into the adrenal medulla, excuse me. It's about 80% adrenaline, 20% noradrenaline that it releases. There is a small amount of dopamine. So directly into the bloodstream, so it's hormonal, okay? So it's a little bit slower to take effect, but it lasts longer if you have these hormones released from the adrenal medulla. So the axons of the postganglionic neurons are unmyelinated, so they exit ganglia via the grey ramus. So we've already said that the white ramus is because it's myelinated, moves the nerve fibres along much quicker. They are long and travel to various tissues via the peripheral nerves or major blood vessels. So you saw that it's a shorter preganglionic and a longer postganglionic. And noradrenaline, noradrenaline is the excitatory neurotransmitter of postganglionic sympathetic neurons that supply all the target tissues except for the sweat glands. In that case, it's acetylcholine, okay? So that's another diagram. You'll see a lot of these in the textbooks. It's good to know. You know, if you can learn most of this, then you'll know what target organs are supplied by the sympathetic and the parasympathetic system and where they exit from the sympathetic chain. So you see here T1 to L2, again, or L3, okay? Your darker greens are preganglionic, your lighter greens are postganglionic. You can see here cardiac and pulmonary plexes, different ganglia that lie outside of this sympathetic trunk, and the target organs that they supply. So you'll see similar variations to that in a lot of textbooks. So the sympathetic nervous system can engage different components together or separately according to the task. So in exercise, there's an increase in cardiac sympathetic drive, increase in muscle vasoconstrictor drive, and a decrease in cutaneous, which is skin vasoconstrictor drive, and an increase in sweat release. However, in states of arousal, it's a coactivation of cutaneous vasoconstrictor and pseudomotor neurons, as well as cardiac sympathetic neurons. So as I was saying about the modern stresses of today, the long-term stress can also increase muscle vasoconstrictor drive, and that can lead to hypertension, okay? And we all know, well, most of us will probably know people that are chronically stressed, and it can be a huge problem. So as I said at the beginning, the nervous system plays a huge role, or the dysfunction also plays a huge role in the body. So it's involved in many cardiovascular and cardiorespiratory diseases. So heart failure, chronic obstructive pulmonary disease, sleep apnea, hypertension, renovascular or pregnancy-induced or essential, and metabolic syndrome. And one of the biggest ones is spinal cord injury, okay? So the sympathetic nervous system and spinal cord injury. So muscle, cardiac, renal, splanchnic, and cutaneous vasoconstrictor outflow is abolished below a lesion in spinal cord injury or acute lesion, a complete lesion, resulting in postural orthostatic hypotension and compromised thermoregulation. Who knows what postural orthostatic hypotension is? Has anyone heard of that? Sorry?
You stand up and get one.
Exactly right. In the situation of a spinal cord injured person, they're not going to be able to stand up, but even sitting up, especially in the very early days of a spinal cord injury. You get them up into a seated position, their blood pressure can drop through the floor. I've seen it many times, and to the point where they can often just pass out. So with a complete high-level injury, what often happens when they've been in bed for a while and you get them out of bed, they get up very slowly. So they'll get in the chair, somebody's got their leg lifted, and they're also on a bit of a recline. And you slowly lift them up and monitor their blood pressure and see how they go, okay? Unfortunately, they can also have the other side of the chain. They can get high blood pressure. So sensory inputs below the lesion can reflexly excite vasoconstrictor neurons through the reflex circuits, leading to uncontrolled increases in blood pressure. So below the level of lesion, you can still get these reflex activations in blood pressure. And that is called autonomic dysreflexia. So it's unique to spinal cord injured people with lesions above T6, and it can be it's life-threatening. It can be life-threatening and classified as a medical emergency. Okay, so blood pressure can go extremely high. It can go to 280, 300 on 180. Okay, people can have strokes, they can have seizures, and there are recorded deaths from this. Okay, so there's still inputs below the level of the injury, even if the person can't feel them. Okay, and that can cause a reflex activation of the vasoconstrictor neurons, which drive up the blood pressure. The problem is that these guys have no way of dealing with that high blood pressure. And that is when it can get out of control, and you need to find the source of what's causing the high blood pressure and resolve that so that you can get rid of this, okay? So that's just a horrible looking diagram of autonomic dysreflexia. So you have a stimulus below the level of injury, and for a spinal cord injured person that suffers from autonomic dysreflexia, it is usually from the bladder, okay? So usually there's a blockage somewhere, so there's a kinked catheter, that often happens, or a blockage in the catheter, okay? The bowel is generally the second most common cause of autonomic dysreflexia. So it is quite common in high-level spinal cord injured subjects, okay? So there's a loss of the sympathetic control below this level of injury. So there's your T6 or above. So there's some sort of stimulus below here. Let's say that there's a kinked catheter, so the bladder's not draining. So there's your afferent stimulus, okay? Still goes to the spinal cord. There's still a reflex activation here. It causes that vasoconstriction. See, widespread vasoconstriction here, which leads to this hypertension. So the problem that we have is that a large volume of blood, the body's blood, is held here in this region, in the gut, in this splanchnic region, okay? And that's why it's a problem if the injury is T6 or above. If the injury was down here at around about T10, you'd have a little bit more control over some of this splanchnic blood. But because it's up here at T6, you've pretty much lost all of the control of this blood. I think it's around about maybe a third of the body's blood is held here in the gut, okay? So there's a reflex activation. The body goes, oh my God, something's going wrong. Vasoconstrict, causes the hypertension. And then the baroreceptors in the blood vessels detect this hypertension, okay? Have we heard of baroreceptors? We haven't heard of baroreceptors? No? Okay, you'll learn about those this week. You'll have a homeostasis and a blood pressure lecture and a thermoregulation lecture. So basically, baroreceptors are sensitive stretch receptors that respond to changes in blood pressure. When they're activated, their sole purpose is to bring down the blood pressure via the vagus nerve, okay? So the vagus nerve is not in the spinal cord, and we'll talk about that in a minute. It leaves at the base of the skull, so it's preserved following a spinal cord injury. So the aortic arch and the carotid sinus are where your baroreceptors are found. Sends a signal up here to the brain. Brain goes, oops, high blood pressure, which is exactly what happens with us. It's the same situation. So if you guys are, let's say you're busting to go to the toilet, okay, your body's going to sense the same thing, okay? It's not going to drive up, it's not going to vasoconstrict and drive up quite as much because these reflex, the reflex activation that happens below the injury is a little bit more sensitive. So it sends a signal up here to the brain says the blood pressure's high, so we'll do one of two things or two things. We'll slow down the heart via the vagus nerve, because as I said, it's preserved from spinal cord injury, so it comes out here, cranial nerve 10, and it'll also send down, and this is where it's wrong, all the textbooks are wrong, descending inhibitory signals, okay? There's no inhibition of blood vessels, it's a withdrawal of vasoconstrictor drive. I cannot find a textbook that gives me the correct answer. There is no inhibition of the blood vessels from the sympathetic nervous system. It's a withdrawal of vasoconstrictor drive, not an inhibition, a withdrawal of vasoconstrictor drive. Either way, the signals get sent down to withdraw vasoconstrictor drive to try and dilate the blood vessels, but it's blocked, can't get through. And the slowing of the heart is not enough, okay? So the heart rate will slow down, but the blood pressure will stay high. Make sense? So until you find the source of the problem and rectify it, this blood pressure will continue to rise. So this is something that spinal cord injured subjects are very much educated on before they leave the hospital, and their carers. People that work within the spinal units, the nurses, the doctors, physios, everybody involved are also very highly educated on this condition of autonomic dysreflexia, because it is extremely common. I think I'm yet to have come across a high-level complete injury that doesn't suffer from this condition at some stage. Some subjects their body will get a little bit used to it, and as their injury progresses over the years, it's not quite as bad, and for some reason, they get worse as they progress down the track, years down the track. So it is an extremely important condition. So moving on to the parasympathetic nervous system now. So this is the brake system or the calming system. The rest and digest system, so it promotes maintenance activities and conserves body energy, as we can see down here. Okay, they've eaten, and now they've gone into some sort of food coma. All right, we've all had a food coma. That's your parasympathetic nervous system. So it decreases the force and rate of the cardiac contraction, it decreases the blood pressure, constricts the pupils, you don't need as much light to come in, it constricts the airways, we don't need to breathe as fast and as heavy, increases activity of the gastrointestinal tract, and increases bile because we need to digest, okay? And the vessels in muscle and skin are not innervated by the parasympathetic nervous system, as I have already mentioned. Okay? So it's known as the craniosacral division. Who wants to hazard us a guess as to why?
The PNS is in the cranial region of the spine and also the sacral region of the spine.
Exactly. So you had the sympathetic, which is the thoracolumbar, and the parasympathetic, which is the craniosacral division. So the preganglionic neurons are located in the cranial nerve nuclei of the brainstem and the sacral spinal cord. The preganglionic neurons are long, so that's opposite to the sympathetic, and the axons project to the postganglionic neurons located in ganglia situated near or within the wall of the target organs. So a shorter postganglionic neuron as opposed to the sympathetic system. And acetylcholine is the excitator and neurotransmitter of both pre- and post-ganglionic neurons within this system. So your cranial outflow, cranial outflow, okay? So 3, 7, 9, and this all-important 10, which is your vagus nerve, okay? So it supplies the visceral organs of the thorax and the abdomen, and it predominantly carries the parasympathetic information in the whole body. So it stimulates the digestive glands, it increases motility of smooth muscle at the digestive tract, decreases heart rate and bronchial constriction. So because it's preserved in spinal cord injury, these things can still happen for those patients. And the sacral outflow, the S2 to S4, okay, supplies the second half of the large intestine and supplies all the pelvic organs. And there's another diagram which is similar to the sympathetic one. So here's your cranial side of things and the sacral. And here's the vagus nerve. So if you have a look at here, here's 3, 7 and 9 and what they supply, okay? The eye, salivary glands. But if you have a look at cranial nerve 10, the vagus nerve, provides about 75% of all parasympathetic outflow. So it comes out here, there's a cardiac plexus, celiac plexus, inferior mesenteric plexus, hypogastric plexus, and it goes out to all of these organs. So it's an extremely important nerve. Okay, so it's one that you'll hear a lot more about. And then your sacral nerves, S2, 3 and 4, and what they go out and supply. So your preganglionic neurons of this, so this is a summary now of the whole system. So the preganglionic neurons of the sympathetic nervous system are located in the intermediolateral cell column of the thoracolumbar spinal cord. So your thoracic and your lumbar regions. The preganglionic neurons synapse via acetylcholine onto the postganglionic sympathetic neurons, either in that paravertebral or sympathetic chain or trunk, or the prevertebral ganglia, so away from that trunk. Noradrenaline is a neurotransmitter at all target tissues, as we said, except for the sweat glands, that's acetylcholine. Preganglionic neurons of the parasympathetic nervous system, it's the craniosacral region. They synapse via acetylcholine onto the postganglionic parasympathetic neurons in ganglia close to the target tissue. And acetylcholine is a neurotransmitter at all target tissues. So basically what I've done is just put in a few summary slides out of a few different textbooks to make it a little bit easier for you guys to understand. So you've got the sympathetic here and the parasympathetic, okay? Everything that we just said, the preganglionic, the neurotransmitters, down onto the postganglionic, and it's the fight or flight response, and your parasympathetic, which is your craniosacral division, the rest and repose, or rest and digest response. This figure is similar to the two I showed you before that were separate, but now they're together. So you've got your organs, or your target tissues in the middle here, your sympathetic division and your parasympathetic division. Where these neurons come out, the preganglionic neurons, okay, and what they supply. And there's your vagus nerve there, again, as you can see, supplying all of these. Yep. And just a similar thing. Again, it depends on visually what you guys prefer. A few different images from a few different textbooks. I prefer this one, but it's up to you guys. Okay, so again, there's your sympathetic nervous system and your parasympathetic nervous system, where they all come out and what they supply. And I am done with 20 minutes to spare, so you guys can have a break.